Welcome, everyone, and thanks for joining us for today's webinar from the Institute for Research on Poverty at the University of Wisconsin-Madison. I'm Natea Taylor, and I'll be your host. Our webinar today is on supporting engaged fatherhood and family well-being, the role of policy from the community level to the federal level. We have 4 amazing presenters who will be sharing their perspectives and research on developing public policies. First, we'll hear from Dr. Tova Walsh, who is an associate professor in the Sandra Rosenbaum School of Social Work at the University of Wisconsin-Madison and an IRP affiliate. Next, we'll hear from Congressman Jimmy Gomez, who represents California's 34th Congressional District and is the founder and chair of the Congressional Dads Caucus. After that, we'll hear from Dr. David Pate. He is an associate professor in the School of Human Ecology at the University of Wisconsin-Madison and is also an IRP affiliate. And our last speaker will be Mr. Daryl Davidson. He is the director of the Milwaukee Fatherhood Coalition and the City of Milwaukee Community Engagement and Achievement Collaboratives. So thank you for being here. This webinar is co-produced with the Wisconsin Child Abuse and Neglect Prevention Board and supported in part by funding from the U.S. Department of Health and Human Services, Office of the Assistant Secretary for Planning and Evaluation. But views expressed by our speakers don't necessarily represent the opinions or policies of that office or of any other sponsor, including the University of Wisconsin-Madison. We have an hour today, and after we hear from each of our presenters, we'll spend the last 10 minutes or so at the end for a live Q&A. You can type your questions in the Q&A box. We did get some questions submitted as people register, so we'll be queuing some of those up as well. Also, feel free to participate through the chat. We love to know who you are and where you're joining us from. And I want to let you know that we have closed captions enabled, so you can toggle those on and off at the bottom of your screen. We'll be posting the slides and the recording of the webinar within a day or so, and you'll receive a link to those by email. So with that, thank you again for being here, and we'll get started with Professor Walsh.
Thank you so much, Natea, and thanks everyone for joining us. I'm really enjoying following the chat here and seeing people tuning in from all over the country and all different roles and different types of work that you all do, and it's really exciting to have you with us. So thank you for joining us. I'm going to turn on some slides now to share with you as I'm presenting. And I also just want to mention as we get started that this is the the latest in a series of webinars focused on fatherhood that have been co-produced by the Institute for Research on Poverty and the Wisconsin Child Abuse and Neglect Prevention Board. And at both the IRP website and the Prevention Board website, you can find recordings of earlier webinars if you're interested to check out some of the other topics that we've covered in this series. And we hope you'll check those out. So thanks again for joining us. Natea just really overviewed where we're going here, but we're going to be talking first a little bit about what the research tells us about fatherhood involvement and about fathers' needs for support at the policy level, and then hearing about policy from the community level to the federal level with experts joining us to present on those topics, and then closing out with questions and discussion. So I just want to start by framing this conversation a little bit and saying something about why we're focusing on fathers and why it is so critical that we consider and include fathers in public policy development. And so first and foremost, we're doing this because we know, and really decades of research establish beyond a doubt, that fathers play a key role in the health and well-being of children and families. And so fathers' influence begins even before babies are born and extends across the life course, with fathers' positive involvement really mattering for child development across all different domains. We also know that fathers play a really critical role in the well-being of their co-parents, whether those are romantic partners or not, that regardless of relationship status, that father involvement and father support matters a lot to those that they parent together with. And the second point that I want to make in framing this is, and why we need to be thinking about and going farther in terms of including fathers in policy and family policy, is that including fathers is a matter of equity. And so this really is kind of a gender equity issue, that fathers face barriers, particularly fathers who have low income, fathers who are from minoritized communities, fathers who may not be married or share a home with their children, face individual and structural barriers to being as fully involved in their children's lives as they might wish to be. And, corresponding with that, many of the service systems that serve children and families often don't recognize or engage men in their role as a parent and caregiver. And so it's really critical that we do more to include fathers and expand our lens so that we are really thinking about the whole family when designing policy to address the needs of children and families. So I'm going to draw on my research a little bit to talk briefly about two areas where I think we need to be doing more in policy to include fathers. And so the first thing that I want to talk about is where we can locate fathers in policy that addresses maternal and child health. And in fact, even just challenging that name a little bit, there's a really wonderful article from 2010 led by Michael Liu that had the title, Where is the F in MCH, meaning where are fathers in maternal and child health? And that article focused specifically on African-American fathers and raised the really crucial point that we need to be thinking more intentionally about including fathers during pregnancy and the perinatal period if we want to really improve outcomes for mothers and babies and families as a whole. And so I'm going to just share a few key findings of my research with expectant and new parents, and then highlight some policy implications of this work. So first is that across a series of studies where we've used qualitative methods, quantitative methods, a variety of different samples with expectant and new mothers and fathers, we hear over and over again in this research that mothers and fathers both want and expect fathers to be involved in prenatal care and pediatric care, as well as involved in pregnancy and the postpartum period in a fuller way. We also know the research is really clear that fathers are increasingly involved in pregnancy and prenatal and pediatric health care. So in recent decades, fathers' roles and expectations of fathers have really shifted, and some of our policies haven't really caught up, don't really reflect the reality of contemporary family life. We also know that participation is highly meaningful to fathers. And so when we think about maternal and child health and think about things like prenatal health care or perinatal home visiting programs, that being included and being part of things and receiving the same kind of anticipatory guidance that mothers typically receive is really meaningful to fathers as they transition to fatherhood. We also know that fathers want to be recognized and included in their dual role as both a parent and a partner. So they're there to support their partner, but they're also there as parents themselves and want to be seen as such. We also know that some fathers feel marginalized or uncertain of how to engage in settings and in systems that aren't necessarily designed to welcome them or have clear roles for them. We know that fathers identify specific knowledge needs, so wanting to know more about how to be involved and how to be supportive of the well-being and development of an infant or a toddler or children at different stages of development. Another thing that often comes up is wanting to learn more about discipline, learning about developmentally appropriate expectations for kids, sometimes wanting to do things differently than the way that they experienced as they were being raised and really want that support from professionals. And in a study, I want to highlight with this last bullet point, a collaboration with my colleague Alvin Thomas and the African American Breastfeeding Network in Milwaukee. One really key finding there was that Black fathers and mothers identified a key role for fathers as partners and advocates in confronting racism in healthcare. And so some policy implications of this work that I want to pull out. First, that we need to be considering and including fathers in assessing and defining maternal and child health priorities. So much policy runs from the federal government through the states with Title V that addresses maternal and child health. It's a block grant program. And some states are ahead of others in terms of thinking about fathers as part of the broader picture of maternal and child health. And I think it's important that more broadly we be considering and including fathers in defining our our policy priorities related to maternal and child health. That we need to be promoting inclusion of fathers in child and family services, whether it's prenatal care, whether it's home visiting, whether it's child welfare, whether it's Head Start, just thinking across the range of public programs and public and private programs that serve children and families, that we need to be ensuring that fathers' needs are considered in policy and program development. Along with that, we need to invest in the necessary training and capacity building so that folks are equipped to facilitate and strengthen fathers' engagement in services. So it's not just using a model that has worked with moms and babies and opening it to fathers, but thinking about what might fathers need that we haven't done before that we could add. How can we adapt the ways in which we do outreach? How can we be responsive to specific needs that fathers might have? And then I want to highlight some really critical work being done by my colleague Craig Garfield and the FCHIP team at Northwestern, thinking about how a piece of shaping our policy agenda is that we need to have data to inform our public policy, and that it's really critical that we establish equitable national data collection practices that are inclusive of fathers. So one of the key data sources that we use to define public health priorities related to moms and babies is the PRAMS data. It's a CDC-funded data collection effort to get a sense of how things are going monitoring nationwide across pregnancy and in the postpartum period for mothers and babies. And historically, the only item that has addressed fathers and prams has been asking moms whether your partner was abusive during your pregnancy. And Craig and colleagues have developed prams for dads and are thinking about how we can learn so much more about fathers' roles and involvement during pregnancy and the postpartum period to inform efforts that would address fathers' needs and strengthen the resources and support available to new babies, to new moms, to families. One other quick, I'll go quickly through this one, but another kind of policy implication of my work, I want to highlight one recent study, which adds to a body of work that really shows that we need to increase support for fathers who want to be a presence and not just a provider. That, of course, we know that, over really since 1965, fathers' time spent with children has tripled, that there's decades of work that show how crucial father involvement in terms of being really an active presence in children's life, being involved, being sensitive, being responsive, being nurturing, not just financially providing, how crucial that is for the well-being of children and families. And so I want to highlight one recent study that both two of my co-presenters here, Daryl Davidson and David Pater, are part of. We have a study that's under review that looked at trying to better understand the specific experiences of low-income and non-custodial fathers, a group of fathers who are often marginalized or overlooked in both research and practice, looking at their experiences parenting infants, toddlers, and young children during the pandemic. And there's a larger paper that we can share with you, but one key finding that I want to highlight is fathers talked a lot about the pandemic as a time of discovery, that the opportunity of that added time at home really led them to learn things about themselves as a parent, to learn things about their children and who they are as individuals and what they need from them, and really offered a lot of new perspective on what the father-child relationship can be and what their children need them to be and need from them. And so this quote is an example of that. The dad says, "I'm a father of 4. My youngest is a pandemic baby. As far as my children, maybe I didn't realize how they wanted the power of my presence. So before the pandemic, I woke up at 6 o'clock in the morning, straight to work, at work till 7 at night. Since the pandemic, now I work from home, and to just watch how happy they are because I'm home kind of gives me joy." And this is, an example that was, we heard time and again in our focus groups with fathers of young children. We heard that dads, it meant a lot to have this opportunity during the pandemic to spend more time at home with their children, and that fathers, including those who didn't live in the home and who maybe shared custody or had visitation with their children, were making big changes to their work life to try and show up and be part of caring for their children during that peak period of the pandemic. And fathers were telling us that it's really shaped what they want for themselves in the future, that they want to continue to be available to their children. They want to be able to show up for them, excuse me, and be a presence and not just a provider. They want jobs that will allow them that flexibility. They want benefits that will allow them to be home when their families need them. And here on this slide, I have the link to an op-ed that Daryl and I wrote talking about why fathers need paid family and medical leave too, drawing on our work with fathers in Milwaukee. So with that said, we're going to move to Congressman Gomez as our next speaker in just a second. He is going to offer a federal perspective from his role as a member of Congress, and Daryl will be talking about his work within the city of Milwaukee. And so I just wanted to offer one resource for those who want to learn more about state level policy to support engaged fatherhood. And so this slide, which will get sent out to you, includes the link to a report on state approaches to including fathers in programs and policies dealing with children and families. And with that said, I'm going to stop here. I never miss a chance to give a shout out to the Alameda County Father Course Fatherhood Photo Bank, from which I drew a couple of photos for this presentation, and encourage you all to check out for some beautiful pictures. And I'm going to stop sharing my screen now, and we're going to turn to our next speaker in just a moment here. But I am just going to make sure, let's see. Okay, I was hustling through there to make sure I was done in time for Congressman Gomez, and he's going to be joining us any minute. So I am actually, until I see that he's on, going to keep talking for just another minute. I'm thinking if I want to turn it over to you, David, or if that won't leave you enough time. Let's see. David, would you like to get started with your presentation, and then I'll just keep an eye out for when Congressman Gomez arrives?
Did you want to do a question in the meantime for
Or we could
yourself?
pause and do, that's a great suggestion. Congressman Gomez is going to be joining us any minute, and I'll just mention for those who are, attending the webinar that we're trying to accommodate his schedule in terms of needing to be on the floor for some votes today, which is pretty critical. So just trying to be flexible here. So let's do a question while we are waiting. Okay, so I'm going to look, there's a question here in the Q&A box, and I'll invite David and Daryl, you're welcome to turn on your cameras if you'd like, since we might all want to speak about this one and the other questions that I might pull in while we have a few minutes. But the first question that I see here asks, what mechanisms exist for holding social services agencies accountable for failing to embrace these findings and recommendations enthusiastically and comprehensively? So the question is, about accountability for agencies to do more to include fathers. And one thing that I want to name here, and then I'll see if David and Daryl have thoughts they want to add, is that a number of states, and you can read about this in this report that I just provided the link to, have established state-level fatherhood commissions that are part of state government. There are a handful of states that have done this. And these entities, and I see Anne weighing in there with a comment from Washington State, where they have a fatherhood commission, as do Ohio, Hawaii, and several other states, Connecticut. I think one piece of thinking about accountability is thinking about creating structures that will represent and kind of be a voice for fathers within state government and have that capacity to connect with local initiatives and local agencies and offer guidance and support and best practice around including fathers. So I think a piece of things is, and thank you, I see a comment there, California now does as well. It's exciting how these are growing around the country, but I think one piece is really kind of institutionalizing a body that has some responsibility for thinking about fathers, centering fathers, and ensuring that others aren't forgetting about or neglecting fathers. Daryl or David, would either of you want to add any comments on that?
Well, certainly I did want to say, by the way, Daryl Davidson with the Milwaukee Fatherhood Coalition. That's my introduction for now. I did want to say that, at least in Wisconsin, it hasn't been codified into any type of law, and that's primarily because there is no formal state office around that subject. But I do agree with what Dr. Walsh was saying. It would have to be a much more formal structure, as well as there would have to be funding attached to it. But I don't think that it necessarily has to be punitive for everyone, especially if it's a matter of training and people have to go to the next level of understanding where not only fathers, but fatherhood policy influences the well-being of the child. So that's my answer for now.
Thank you, Tova, Dr. Walsh, I should say, for your comments, and also Daryl. I would also add to that we have to really examine too our current social welfare system that really does somewhat support mothers and children or parents with children in a way that does not always think of fathers as one of those parents. So I think it's an issue of sometimes us just investigating what services are being provided within that particular agency, and whether or not there's a way that you can look at how a particular policy or statute within your state or county will allow that parent who might be a father, a person who identifies as a father, to receiving a service. And I'll give one quick example of a project I did in Kenosha. It was a WIC site, a women's, infants, and children's site, and they were providing services, of course, to women and children, and many fathers were coming. And so the administrator there decided they really wanted to have a program for men. We looked at that for 6 months. We saw that over 1,000 men were coming, and now they have a program for fathers in the Women and Infants Children's Program. And it was just a matter of them talking to people within the state to see if that was possible. Because that is a parent. And I'll talk more about how I define parent in my own talk, but I think that's an example of how you can look at what are some of the possibilities within your own given state or county as to how you can include men in receipt of services.
Thank you. So I see Congressman Gomez is here with us, and we're delighted to have you. So I'm going to just do a brief introduction and turn it over to the Congressman. Before I do that, I'll encourage all of you to just check out the chat, where a lot of folks are adding resources from around the country, like the California Fatherhood Council resources here. Lots of neat things popping up, so be sure to check that out. So our next presenter, Congressman Jimmy Gomez, represents California's 34th Congressional District in the U.S. House of Representatives. He is the founder and chair of the Congressional Dads Caucus. You may, like me, remember seeing him wearing his son Haj in January during a series of votes on the House floor for a speaker. And Haj is just such a beautiful baby. So we're honored to have his father with us today. And we're just all really excited to hear more about the work that you do with the Congressional Dads Caucus. And I'll just say for everyone joining, Congressman Gomez, this is a quote from Congressman Gomez in launching the caucus. He said, "It's rooted in a simple idea. Dads need to do our part advancing policies that will make a difference in the lives of so many working families across the country." And so we're looking forward to hearing from you about your vision for doing that work and what you've been doing with the Dads Caucus. And we're so appreciative that you made time to join us. So thank you, Congressman Gomez.
Yeah, no, thank you. Really appreciate the invitation. And I really appreciate everyone gathering to talk about this issue. As was mentioned, I took my son Hodge to the House floor during a speaker vote. I took my son not because I thought he would go viral. I took my son because that's what people do when they have a new baby, when they get sworn in. You take your children to the House floor. It's the only time you can do that, and everybody does it. And it was awesome because what you want to do is you're just proud of your kids and you want to show them off. And I had no idea by wearing my son, in the baby carrier, which I was doing a lot in the early days, and I still do. And I do it just so that he can see things and kind of have that experience, that it would go viral. But when and a lot of the attention we received, that I received, was something that made me kind of think about how the double standards exist, that men often get praised for doing things that women often do, but are often criticized for doing or not even acknowledged. So one of the things that made me realize that we can't let this moment go. We have to use this viral moment and turn it into a movement. And it's something that a friend of mine who I work with on paid family leave, I've been a long-term advocate of paid family leave. I expanded it in California under a bill called AB 908 with the wage replacement, making it more progressive. And then she texted me and said, "Hey, you should start a Dad's Caucus." And I said, somebody else said the same thing on online or when I was walking by, I forget which one it was. And I said, "We're going to do that." And she said, "We tried to do it. But this paid leave US group, they tried to do it. They tried to make it bipartisan and bicameral. But the Republicans would always back out." And I said, "Yep, I'm going to actually do it where it's just Democrats to show people that there's real potential there. And we're only going to do Democrats only." And that's what we did. We wanted to start the Dad's Caucus on that simple idea. Dads need to do more at home and in the halls of Congress. We have a concept of default parenting, the fact that it's often the mother who is the default parent that does certain type of work in the household, especially when it comes to raising the children. Well, there's also something where I call default legislating, where it's automatically assumed that certain issues are under the realm of female legislators for mothers, paid family leave, the child tax credit, childcare issues, that they're the ones that are responsible for fighting for these issues. But if we want to make progress on these issues, dads and members who are male have to step up to join these fights. So we started this Dad Caucus on focusing on 3 different issues: paid family leave, which I've worked on extensively, the child tax credit, which cut child poverty in this country by 40 to 60%, depending on where you lived, huge, and impact. And we want to see that it's back on the table and implemented in law. Of course, the child care issue, because parents are hurting across the country. One of the things that what we know and what we've seen is that childcare is costing an average family about 26% of their income a year. That is super high. And then when you take into fact that the average family is also now rent burdened, meaning that they're paying at least 30% of their income towards rent, the average American family is paying close to 60% of their income to 2 things: rent and childcare. And that not only puts stresses on the family, impacts the long-term financial health of that family, but it also has a huge impact on our economic gross domestic product. Most people don't know that. So economists are talking about childcare and housing as 2 pillars that we got to tackle if we want to have a healthy economy. So the way we're approaching it is building out this team, having a group of dads here that are constantly talking about these issues. So we have about 34 members. all Democrats, but they run the spectrum on politics. We have progressive members, but we also have moderate members and then blue collar members. And this issue is just touching so many folks. So we're growing, and we're having an impact. People have asked us to endorse their bills on childcare. They asked us to endorse their bills on the child tax credit, on paid family leave, on the momdom bill. So people are approaching the Dad's Caucus to have our endorsement. But it's also, we're weighing in on issues like changing tables to make access of changing tables a little bit more prevalent in not only the Capitol, but across the country. So, but this has been an educational moment for myself, as well as dads that are members of the Dad's Caucus. One thing that somebody approached me on was she is a researcher that lives in my district from the USC School of Medicine, and she researches the science of fatherhood. And she basically does research on how the brain of a man changes when they become a father and they actually have time to bond, and the health benefits of that. So but a lot of people don't know about that science. They don't even know that there is a field called the science of fatherhood. So, and because they don't know that we have to change our policies and our programs to really incentivize and uphold parents, mothers, but also fathers, that we often saw it as one way. So we want to do more and expand some of that funding that we have, but it's not enough. We got to do more. And we're starting to see a shift. And it's interesting. Heather Cox Richardson, she's a historian, wrote an article, blog post for her newsletter about the Dad's Caucus and what that means. And she kind of talked about, that she tied it back to the Bill of Rights, the expansion of government, the role of government in people's lives, the role in government in helping families, and what that means. And she was asked the question, she's like, is this marks a moment that the mindset of Congress and the mindset of just Americans, when it comes to the role of fatherhood, what does it mean being involved, and does that make a difference on policy? And I think it can, because for the average person, people are still trapped in the old way of thinking, right? But it is changing. There are parents out there. I think there's more stay-at-home dads than I ever imagined. People have come and talked to me about their issues. So we're trying to take this all in. And the way I'm also doing it is, one, you got to do it monthly. So the Dad's Caucus meets once a month, right? And we do that because we want people to know that this is not just a thing we're doing for attention, but we're doing it as a way to bring more people to the table, to lift different voices, to have people think about things differently. We've had a roundtable with Doug Emhoff, the second gentleman. We had roundtables with building trades who know that if their workers don't have access to childcare, they can't get to work. We've had a workshop and a roundtable with gun control groups that recognize that the leading cause of death for children in this country is gun violence. And so we've kind of started doing a lot of this work. But Jessica Seinfeld with the Good Plus Foundation, and how it needs to really focus on policies that promote fathers being involved. There is, I think I quote this gentleman, they said that dads, a lot of people call some dads deadbeat dads, but they're not deadbeat, but they're dead broke, right? So this is stuff that we got to really, yes, Darby Saxby was the constituent. So these are issues that we want to get more involved. But I told my staff we have to do a few things. One, like I go back to the I'm an organizer. I came from the labor movement. So I go back to, how do you get people involved? How do you create an organization? How do you create credibility? One, you got to, the pathos was there, right? Pathos, the passion, the fact that children get a lot of people's attention. That is great. But you also need the logos, which is the logic behind what we're doing. And that's what the researchers are providing. Why is it important for dads to be involved? Why is it important for the health of the children, for reducing postpartum depression? Why is it important? All right, the logos. And then the ethos, which is the credibility of it, is how do we create that credibility by using research and science and social science, the federal government, members of Congress ourselves, to bring more attention to a lot of the stuff that all of you are doing, especially at the state level, and some of the stuff that we're doing here at the federal level. I don't know all these programs. It's a new field. I knew paid family leave, the child tax credit, and childcare because of my work on Ways and Means. But we got to kind of also look at where we can expand through executive action, especially when Congress moves so slow. But with that, I'm excited just to be here with all of you. You guys people are doing amazing work. And the more and more dads get involved, the more and more people understand that this isn't about dads. This isn't about mothers. This is not just about children. It's about families as a whole. And when you promote families, you have not only stronger communities, but you also have a better outcomes for your entire country. So with that, I want to just say thank all of you for having me. But we're only getting started with the Dad's Caucus, and we're going to be looking at what else we can do. And I just noticed some of the chats. Somebody said that deadbeat is still a word. We're gonna have to look if we can change that. That's what's the good thing about that's used in federal regulations. Let's see if we can do something about that. So with that, I'll kick it back over to the host. Thank you so much for having me.
Thank you so much, Congressman Gomez. It's exciting to hear about what you've been doing and to think about what's ahead for the Dad's Caucus. So thank you for joining us and telling us a bit about your work. I'm going to introduce Dr. David Pate now, who's going to be our next speaker. David Pate is an associate professor, a visiting associate professor of consumer science and human development and family studies here at University of Wisconsin-Madison. And before he starts, I also just want to give a special shout out to David for helping to inspire the topic of this webinar. We've had a series of webinars focused on fathers, and David always reminds me, we need to talk about policy. And, we focus a lot on father-child relationships and practice, and sorry, I think I'm hearing somebody there. But appreciate David saying this is really important that we focus also on the policy environment that shapes the opportunities that fathers have to be the parents they want to be or to not, or constrains them from being the parents they wish they could be. So thanks, David, and I'm going to turn it over to you now.
Thank you so much, Tova. Before I begin my discussion, I want to thank several people, Tova, for definitely listening to me and being willing to have this discussion, but also want to thank my photographer, Carlos Javier, who took this beautiful picture of a father and his son, Dr. Susan Stanton, Jacqueline Boges, Marietta McDaniel, Ron Mincy, and IRP also for always being a great sponsor of this work, and also a good friend, Dr. Chris Barnenow, who has helped me really think about how do we look at fathering in a way that I hadn't done before when I was doing a research project with her. The focus of my conversation is going to really look at the issue of child support and low-income men who are in fatherhood programs. I've been someone who's been a part of this discussion for over 30 years. I myself was in the very beginning was a social worker who conducted fatherhood programs, who was involved in looking at how do men establish paternity, are engaged in child support programs, but also particularly child support as it pertains to fathers whose children receive welfare benefits or cash benefits. Has been my area of study for the last 26 years as an academic, but more so as a person who's been interested in fathers for more than 30 years. The reason I bring up my friend Chris Barnell is that she's an occupational therapy scholar. And one of the things she brought up when we were doing some work on looking at fathers' involvement in the issue of infant mortality was this whole idea that fatherhood is an occupation, like motherhood is an occupation. And if you look at it from that perspective, what are the details? What are some of the attributes? What are some of the issues that will either enhance or interfere with their ability to be a parent? One of the things that I have seen as a social worker and as a scholar is that many people do not even see men or men who have children as parents. And when we look at them solely as a father, oftentimes that word father comes along with the word of being a breadwinner and someone who's financially providing only financial resources, which is where we somewhat get caught up in the issue of how we look at this issue of child support as it pertains to those who receive TANF benefits. Also, my talks are really focused on looking at issues of race, class, and gender. Race, class, and gender are three very unique systems of power. Those systems of power have very big significance and influence as to how we think about the person who is identified as a father or involved with their children or a mother. They also help us understand how power and privilege come into play and make a difference as to how we will provide services or not provide services to someone in this country. But also we need to really look at what are some of the things around history. What around how historically have we looked at issues of who is a parent, who is a provider, who is engaged with their children, and who is deserving of services, which I think a lot of this discussion comes down to. I would say that for the work that's been done, particularly as it pertains to fatherhood work, there's been 30 years of research from very noted institutes such as MDRC and MEF and Urban Institute, who have very well documented what are some of the challenges and issues with fathers when they are involved in fatherhood programs, and also have shown some modest results around what works and what doesn't work and are continuing to do that. But I'm also going to be narrowing my conversation to whom I see are major participant in fatherhood programs in particular, as many African-American men whom I've spoken with or been engaged with in my own work. Many of these men speak to the frustration of being men with no money or a job, the difficulty of supporting themselves and their children and their families, of the insurmountable child support debt that may land them in jail or cause their credit to be somewhat destroyed, a debt that ensures they will never catch a financial break. Many of these African-American men or African-American men in general are disproportionately poor, disproportionately unemployed, disproportionately incarcerated, and might be disproportionately represented in sanctions for non-payment of court-ordered child support. Given what we know about this difficult to avoid debt, from what I've learned and many scholars on this call who I've noticed are here today, this difficult to avoid debt in relation to family prosperity and about racial disproportionality with regard to poverty, unemployment, and incarceration, I think we need to have a discussion when we look at all this wonderful work that we're hearing from Dr. Walsh, and we'll hear about from also Daryl Davidson, and also the wonderful work we heard from the congressman just now. What really I find is unfortunate is some of the way policies are currently written, particularly as it pertains to child support policy. When you are when you are a mother who is seeking benefits to take care of your children, when you both are poor, and when you have a child support order that is assigned to this particular father, and that money that he is paying in child support is reimbursing the state, because that is the reason why child support enforcement policy was created in 1975, was because it was a cost recovery program. And currently in 26 states are currently not giving any money to children when the father pays child support. And that to me is problematic around how does that child's well-being get interfered, and all this wonderful work that people are doing to have men be engaged with their children is somewhat being compromised when we're not examining how are we not really looking at how is the father who may be cooperating in the best way he can is not being recognized for what he's doing. And also these children are seeing their parents in a stressful situation that may cause additional issues. When we look at these when we look at specific attributes of what makes for a successful, financially sound person, there's a plethora of information around how education really supports people. If you get more educated, you tend to do better. How income, depending on your level of income, how important class is around how you're able to provide for your children is a reality. And this whole issue of what wealth means. And particularly if you look at some of the scholars who I'm going to talk about in a few minutes, particularly Derek Hamilton and William Darity have talked about this whole idea that we've seen for those who are Black in this society, education is not the great equalizer that we would like it to be, because unfortunately, based on policies that have been either promoted or carried out, there's still some, even within education, we're seeing there's differences around what is the wealth accumulation between a Black and white person in this particular situation, in this particular research I'm sharing with you today. So when you look at how are people going to be able to be involved in some of the systems that we're requiring them to do, like a child support system, if wealth is being extracted from that family, if income is being extracted from that family, or if there's not been a historical space of wealth accumulation, we're only further compromising the well-being of that family and the well-being of those children and all the great work people are doing in all these programs. We look at employment. Employment for so many people by Black and white has also still not the great equalizer, as research has been talked to us about through Derek Hamilton and William Darity and others, and that we are seeing that for those who are white versus Black, income, the amount of money they're making is also somewhat different, that they are not able to support in the same way they would like to, and that as many of the men have told me in many of my interviews, that unemployment is a real issue. The issues of discrimination are very clear. Diva Pager, unfortunately, who has since transitioned, was very well a noted scholar who really documented this issue of how race plays a major issue and who's employed and not employed. And even some more recent work that I came across most recently through Austin Algernon, who talks about this whole idea that even amongst those who have been formerly incarcerated, which really supports some of the work that Diva Pager brought up, that white people still have a major employment advantage even when they have the same attributes of being incarcerated. They have the same skill level, the same education levels, but we still see that those who are Black versus white are not having the same opportunities to still be able to be engaged in employment. The other things that we're finding is that there's a variety of issues around discrimination, bigotry, implicit bias that are affecting Black and Latino workers. We're still seeing that networks play a major component into whom is able to maintain and hold a job. We also are seeing that people don't understand that when people are engaged in the child support system, and there was a lot of questions on child support and when what people is offered early on, that people have to remember child support is two systems. There's a system for those who are very poor, who use a system where the state is getting, it's the state versus someone, which is generally the non-custodial father. And then there's another part of that system where someone voluntarily says, I need to be able to get money for my family, so I would ask you to help me do that. And they serve as a conduit to do that. But those for whom I'm talking about, where the state versus that person who doesn't often understand what's going on, there's these other issues where there's an intersection of poverty and racial inequity that's real about this program. And also for men and for fathers who are generally engaged in fatherhood programs, there's a requirement around the whole idea of there's assistance with employment, which is great, but with that employment, there's going to be a child support order. And therefore, if there's going to be if there's not an ability to recognize that the program needs to also think about how much are we affecting his well-being, that we're not really, in my opinion, helping that family to be in the best space it can be. And so therefore, there is this issue around racial inequity and poverty that child support may be contributing to and not even recognize or may not recognize that they're doing that. Also, when we look at our social welfare system, when women who are the custodial parent are applying for any of these benefits, and I want to thank my former doctoral student, Dr. Susan Stanton, who looked at this issue of a cooperation. Women have to cooperate and name a father. If she receives TANF benefits, Medicaid benefits in the state of Wisconsin, CHIP benefits or health care, food stamp benefits, as well as other additional child care subsidies. And therefore, when I was just doing a project just a year ago, sitting in the courtroom, many fathers didn't understand how the mothers were required to do this. So again, this issue of not being fully educated on how the system works, how statutes are in place that requires a little bit more of an understanding, it can be problematic. And finally, I know we don't have much time, but again, the final thing I want to say is that we need to really think about how if we're going to make, if we're really trying to help families to be the best they are, particularly those whom are very poor, and the majority of them that owe this 114.1 billion debt are those who are making no money, based on more recent research from Maria Cancion, as well as former research done by Elaine Sorensen. We need to figure out, how do we really be more inclusive to include those who are not doing well. I'll stop there, and I want to thank you for that opportunity to be quick and give you my feedback on what I know, but I'll turn it over to Tovit. Thank you.
Thank you so much, Dr. Pate. Okay, so next up we have Mr. Daryl Davidson, who is the director of the Milwaukee Fatherhood Coalition and the City of Milwaukee Community Engagement and Achievement Collaborations. He is a regular panelist on this series of webinars, so some of you may recognize him, and we're always really grateful to have Daryl share his depth and breadth of experience in the City of Milwaukee today, with a focus on how policy at the more local level can support the engagement of fathers with their children. So I'll turn it over to you, Daryl.
Thank you, and I appreciate that. I certainly do appreciate the inclusion of our Congressman Gomez, who I know is doing some great work in Washington, D.C. right now, especially because he brought up some very significant points that are relevant to what's happening at the local level. It is true that we are facing multiple instances of bias based on gender discrimination, as well as Dr. Pate was mentioning, there is a historical connection between what's happening with race and poverty and what we see at the local level. It is also a fact that the city of Milwaukee has support from not only its mayor, but also its county executive in addressing many of the issues that are taking place with fathers. The reality is, though, we do not have a state office of fatherhood that can center much of the activity that would be prioritized throughout the state of Wisconsin, as well as be a landing spot for any type of federal funding that could come to the state. Now, our Milwaukee County Child Support Office is the one that did receive the Healthy Marriage funding that was mentioned. I did see that in the chat. So they are the hosts of the Fatherhood Fire group that works with us, and also is a part of what we've established as a Milwaukee Fatherhood Summit, which functions as a one-stop shop to address many of the issues that our fathers are facing. That would include issues around parenting and parenting classes, child development, establishing paternity. We also have relevant issues every day at our office that recognize the barriers that fathers who are non-custodial parents or are not on the birth certificate, those individuals have been seen in some instances as the negative stigma of what fatherhood exists as. And so there are negative connotations. But to that point, we are addressing that by educating those fathers. We do have Child Support 101 classes that are running out of our center, as well as with our Fatherhood Summits and our mini summits. And we are encouraging our grassroots partners to be a part of moving that type of education along in the community. So one thing that I would express is there needs to be support for various fatherhood initiatives that do exist in our communities. I'm looking forward to seeing that happen all over the country, as well as enhancing their knowledge around legal rights for those individual fathers. Something else that is helpful for us in the city of Milwaukee and Milwaukee County has been our relationship with our Milwaukee County criminal justice system. Now, it is a fact that we have a disproportionate number of African Americans who are incarcerated at every level. So that's local and at the state level. We do have a program, and I did see that we have our Nurturing Fathers national trainer who is on this program, who goes into prisons as well as into Milwaukee County corrections and does education with the fathers who we know are coming out. Now, why is that significant? Part of it's significant is because it's great to have a fundamental transition where family is a connection to that father, and the future of their family is part of the inspiration for that individual making sure that they're making appropriate decisions. But even beyond that, let's get real specific here. If we're talking about African Americans and a larger number of them represented in the prison industrial system, well, we also have them there for a longer period of time in a disproportionate manner too. Sometimes we're finding that individuals who aren't even convicted are actually jailed and are waiting for a court hearing, and they are staying in longer because of their court representation. So we look forward to more policies that could assist them with getting out if they have not been convicted, or any type of transitional programming for those individuals who serve their sentences that does support the need for them to be thoroughly in addressing what's taking place at their home and with their families. I don't want to take up too much time with some of what I wanted to say, primarily because I know we have questions. So what I will say is this: at the community level, we do need a much more organized and also funded effort that's going to prioritize what's taking place at the local level. Individuals are seeing us with a variety of circumstances. Some of them are coming in as individuals who did not have a father or a father figure present in their lives, and so they don't have a jumping off point on what to do. Prior to us teaching what fatherhood should look like to fathers, we also should be teaching that information to individuals who are planning to be fathers. And I'm looking forward to supports related to that also. Our Milwaukee Fatherhood Coalition is a design that is a collaborative body. There is no particular stance that goes in front of fatherhood and family. And therefore, under the umbrella of fatherhood, we want to see any group, organized or not, any individual that has prioritized fatherhood and making sure that that is a presence that is seen more as a positive in the community, as well as something that is going to connect to job services, connect to education, connect to inspiring others so that they can make a difference in creating new policy at the local level.
Thank you so much, Daryl. So we are going to move into some questions and discussion. This has already been so rich, and there is so much happening in the chat. So I encourage you to check that out. I'll just name to make sure everyone sees it. That Laurel West put a resource in the chat that the Good Plus Foundation and Ascend at the Aspen Institute collaborated on, a child support reform toolkit that I think may be of high interest to folks in this Zoom, since many of the questions that came in advance of the webinar and that are coming in during the webinar really relate to child support and the need for reform. So I want to call attention to that resource, then give a shout out to the great work that Good Plus and Ascend are doing together. I also want to invite others to add in the chat. There are a couple of places earlier in the chat where somebody named in Franklin County in Ohio, some ways that they are innovating with child support. If others on the Zoom have ways that you're innovating in your community, we'd love for you to enter that in the chat so folks can learn from it. And want to acknowledge and thank those of you who've been saying that we need more spaces that bring people together. I see some great connections happening between people involved with state fatherhood commissions saying we need to spend more time learning from one another and having state level learning collaboratives. So feel free to use the chat as a resource, and I hope we can think about, creating spaces going forward for this conversation to continue. With that in mind, we've got just a few minutes for questions, so I'm going to turn to some questions and invite Daryl and David to weigh in on these. One in particular that I wanted to start with here, there are a handful of questions that came in early on, and I'm seeing it in the chat too, suggestions around involving fathers who are affected by policies and creating policies. And I would love to hear you two talk about, how you think about bringing out the perspective and voice of fathers who are experiencing the ramifications of policies, and how we can engage fathers and use their lived experience and wisdom to shape policy development.
Well, I know that for several of my research projects, I've always engaged men. And I was going to mention that the Georgetown Center on Poverty and Inequality has a really good memo on child support and fatherhood that I was a part of. And I see that Natalie already has mentioned that. But I think, I have a project right now where men are serving as my primary expert panel. For helping me to figure out what policies are needed or what policies should be recommended to help men, particularly men who have been incarcerated are now returning home and wanting to be engaged with their children. So I think it's an important concept, an important part of research that I engage in, because I just think it just adds a lot more richness to the reality of people's real lived experiences that I don't have. So I do see it as an important part of my work.
And I'll also add that a couple of policies that I know need to be addressed would be enhanced legal rights, including the sharing of custody arrangements and the decision-making authority. Often we're finding fathers who are coming to our center who are finding out that they're fathers later than expected. So they didn't know that they were a father until there may have been a letter that showed up at their door, and the child might even be ready to talk in some cases. What we want to do is to make sure to prioritize the best interests of the child, of course, and if that requires making a stronger effort for visitation schedules to be changed or acknowledged, we want to make sure that those fathers who are promoting that they are advocated for too. I did see also that the language around what's being addressed related to fatherhood, there was the term child support enforcement, and using the term child support services actually does give a different type of focus on what the office is there for. And I really would like to see some of the efforts which are used with curricula that I am familiar with that address fathers and mental health and family mental health come more to the forefront too.
Thank you. So another question that we have here, and I'm looking, when you see me looking to my other screen, I'm looking at a list of the wonderful questions that many of you submitted when you registered. So I'm pulling from there for some of the questions that I'm bringing in now. And one question that came up several times from folks was about the kinds of collaborations that are needed to change policy and to really impact the lives of fathers. So somebody wrote, I'd love to hear from speakers about their experiences working across academic and policymaking institutions. How do you partner to do this research and to make policy change? I know we've got folks represented on this call from agencies from local to federal, from academic settings, from foundations, from all different sectors. And I would love to hear your thoughts about the kinds of collaborations that are needed to kind of move the needle. David, do you want to start? And I'm wondering, I've heard you talk about you've made some policy change in your life, and you're someone I really look up to and admire for just the impact that you've made. Maybe you could talk about how you make change and what kind of partnerships are needed.
I mean, I was able to make change early on through working with lawyers, which is really a part of my work. The child support the work that I've done for fathers, which is for fathers who are engaged in the child support system, has come to the point where I had lawyers who had to sue the state. And in one case one case was where the fathers were not receiving the same service as someone who was of money. And therefore, we wanted to be sure that everyone had access to all the same services. And also just wanted to make sure that due process was a real issue, because so many men do not understand the legal part of the child support system. And it's a legal program. It's not, it has an administrative component, but it takes the best of the legal part, takes the best of the administrative part. And unfortunately, many of the men who are poor don't understand that. So for me, my collaborative work has been with people who are anthropologists, with those who are lawyers, those who are legal scholars, to help me understand how can we move the needle along in some way. The other issue is that I just wanted to mention, and I appreciate, no disrespect to what Daryl said. I know that child support has changed its name to child support services, and for some people that really is a service. For others, it really is an enforcement, because women who are poor are required to assign and cooperate with the state. And so that's a very different dynamic when you're poor and you're trying to get that work, you're trying to be a parent. And child support is helpful to anybody who receives it. But we have to be clear about there's two different systems here that are in work. So I think that for more people being educated on how the system works is what's going to help move the needle, in my opinion.
I also want to chime in with what David was saying, because it is a fact that if the father is not on the birth certificate, that is a big deal. And that's what many of the fathers don't completely understand. Even if they were in the birthing process with the mom, the fact is they are not seen as a legal father. They may not even have the ability to object to an adoption of the child. So establishing that type of relationship it does mean that we need to work with lawyers carefully. The other elements that are important, I work with Job Corps and also employment centers to make sure that fathers do not only have an income, but there's a relationship between the work and provider as well as the family aspect of it. And we do want those individuals who we are partnered with, who are the employers or who are running the part-time centers, to have a relationship with the fathers and have a clear understanding of what the responsibilities of the fathers may be. Because in some cases, the father could say, well, I need to take off because my child is sick at home. They're not going to let that father do it. They're more likely to let the mother do it. So we talk to employers about that. And of course, we do work with our university researchers too. So it's a bevy of supports that we do have that are on this mission with us.
Thank you. So we are coming up on the hour here. And so I think we'll run over by just a minute or two. And I'm just going to invite both David and Daryl, if you want any, final thought that you would want to share or takeaway that you want to leave folks with, and then I'll do the same and we'll wrap up. So maybe David, I'll turn to you if you have any last thoughts you'd like to share before we wrap.
I really appreciate all the comments that have been coming in. I really would hope that we continue to provide services for men. I would hope that you work within your various cities or states or counties to really promote policy that includes men as parents, and not just as breadwinners and financial providers. Because so many of the men I talk to whom are poor and low income are looking to be engaged in their families in ways that really rewrites the script on what does it mean to be a parent in the society. So that's where I'll stop there.
Thank you. And Daryl, yeah.
I would like to say, for those service providers who are working with moms or working with families, remember, creating a more father-friendly environment actually is making a more family-friendly environment. And so we are encouraging you to make sure to educate yourselves, get the training, ask people who are a part of putting this webinar together so that you can get some appropriate guidance and establish what you need and get your questions answered. Thank you very much for attending.
Thank you. And I'll just add, we've talked about this in relation to services in previous webinars, but with policy too, to be thinking about both how family policy can be inclusive of fathers and about specific needs that fathers might have. So I want to kind of emphasize those two things, that when we're creating policy that's about family well-being, family mental health, maternal and child health, that there needs to be a space for centering fathers within that, not in a way that supplants or replaces mothers, but alongside mothers as important family members and caregivers. And also that fathers have some unique needs that we need to be attending to with policy. And as David really importantly reminded us, all fathers don't have the exact same needs, right? So recognizing the diversity of fathers and the systems that create added barriers for specific groups of fathers. So in his work with Black and African American fathers, but thinking about specific needs of fathers as well as being inclusive of fathers in family policy. So thank you. And with that, I'm going to turn it over to Natea and we're going to wrap up. Thank you all for joining us.
Thank you so much to Dr. Toba Walsh, Congressman Jimmy Gomez, Dr. David Pate, and Mr. Daryl Davison for this rich discussion and for sharing their time, experience, and research with us today. As we mentioned before, we'll be posting the slides and the recording of the webinar within a day or so, and you'll receive a link to those by email. So thank you all for joining us and have a great rest of your day.